I'm Dr. Christian Acharte here at Pennsylvania Pain and Spine, and I was asked to have a little discussion about the benefits of stretching and how it has improved the lives of our patients here at PAPSI, Pennsylvania Pain and Spine Institute. So before we start, I want to formally say this as a disclaimer. This is not formal medical advice, and if you have any questions, please seek the attention of a medical provider, preferably your PCP or one of the pain doctors, to best describe your specific needs. The second point, we're having a little bit of technical difficulties, so I think the chat tool is kind of not working. So unfortunately, we might not be able to do the Q&A section that we were intending to at the very end of this. So having said that, I'd like to start off by saying, speaking a little bit about the importance of exercise in general. And what I mean by exercise is not just stretching, but the whole concept of movement, strength training, and doing what people refer to as cardio. Studies have shown that just general exercise or being fit is good for improved life expectancy. Also, in general, it seems to be associated with better medical outcomes. And I don't mean just in pain, but regarding controlling diabetes, blood pressure, heck, even improve how well one bounces back after surgery. Within the context of exercise, though, one thing that I feel like a lot of people seem to forget is this notion of stretching, which is separate from exercise. And I feel like I have to explain this a lot to my patients. Where exercise really also encompasses the notion of strength training and cardiovascular fitness. That means how well your heart performs while you're moving around and doing activities. Stretching really mostly focuses on how flexible your joints are, making sure that your muscles and your tendons can actually reach the full range of motion. In my experience, it really, increased flexibility, like stretching, helps in decreasing the rate of risk, the risk of injury. That is to say that when someone, if someone undergoes a trauma, if someone falls, someone slips on something and hurts their joint, if they are flexible, they are less likely to hurt themselves. They are less likely to sprain that joint. They're more likely to quote unquote roll with the injury. So that has been shown to be true. People who stretch undergo less serious injury, in particular at a decreased rate. Also, the way I tend to use, and I'll use this as a nice little caveat to go into a discussion as to how we use stretching as part of our clinical picture here at Pennsylvania Pain and Spine. But regular stretching among my patients seems to prolong the effects of the treatment plans we set out for them here in our clinic. So if I do a back injection or some kind of knee injection, I always emphasize to my patients, if you want this treatment to last long, I have every intention to make you better, but if I want to decrease how many injections you get, decrease how many times you need a medication, I always encourage my patients to stretch. It results in better outcomes and better, longer lasting treatment response. So now, with regards to how I tend to use this in our practice, or particularly in my practice here at PAPSI, I always start off by talking to my patients, seeing where on this spectrum of relatively inactive to very fit individuals they lie. And if appropriate, I tell them that you really should consider exercising a little bit more. If that's a little much, then I always say, let's work on just flexibility. Some studies regarding more musculoskeletal diseases have shown us that you don't require anything more than holding a position 30 seconds to really adequately stretch the muscle fibers. So it does not take too long. It does not take a big chunk of your day. What I often tell my patients is, once I show them a particular stretch that would help their particular needs, it's like, do this stretch 2 times in the morning, 2 times in the evening. Let's start off there. You only have to hold it 30 seconds at a time, literally no more than 2 minutes of your day. And I think anyone can carve out 2 minutes. And I tell them this to prepare them for whatever treatment plan we come up with together. That is to say, if I diagnose that a part of their pain is coming from muscle spasticity, and in my opinion, and I think I've talked about this a little bit in the past, muscle spasticity to me is like the silent source of pain. Everyone always focuses on joint pain, on a pinched nerve, on a plethora of other things, but muscle pain is always forgotten in that in the melee. So if you are in pain, and I can't emphasize this enough, one of the initial responses the body does is it tries to guard and hold on tight to whatever the heck where that pain is coming from. What that results in is tight muscles so that that part of the body does not move. And muscles that have just basically have turned to spasming will intrinsically hurt. And that is a different pain than whatever caused whatever caused them to spasm in the first place. So even if you are treated for a pinched nerve, even if you are treated for arthritis, I often have patients like, doc, yeah, that helped, but it's weird. I still have this back pain, and they are kind of lost for words. You're like, this isn't helping. And they a lot of times they go down this emotional spiral of things aren't helping. And sometimes all it takes is explaining to them that pain is often multifaceted, and muscle pain is just another face that needs to be treated. The best way to do it, I mean, yes, there are medications. Yes, there are some procedures that can be done. But the best way to do it is spending some time at home to stretch and forcibly loosen those muscles. So like I said, come up with a treatment plan, implement it, whether it be via medication, working closely with our colleagues in physical therapy to show them what the right exercise would be. And then having them continue these exercises, these stretches, to prolong that positive response. But yeah, that's kind of how I explain things to help have my patients wrap their head around the experience that they're undergoing when they come and see me. I think it's helpful to explain to them where all the different pain points can be coming from, and how one can attack each individual part separately. In this case, muscle spasticity, responding well to stretches and physical activity, when conjoined with some of the treatments we can provide here at Pennsylvania Pain and Spine, whether that be medication or minimally invasive injections and other procedures. One caveat that I always say, and this is just me being honest, no doctor is ever going to be able to promise you absolute pain relief. What I always tell my patients, and stretching is part of this, is from the moment that I see you at our first encounter, I want to make you better. I can't promise you absolute pain relief, but I can get you to a point where you're walking more, where you're actually enjoying your daily activities. You're back to doing the things that you love to do. And if I can bring the pain down to a point where it's bearable, then I'll consider that success. But I will never, especially for some of our older patients, I will never promise an absolute thing that is like absolute freedom of pain, because I'm just not going to lie to people. And I think that when people do that, it can become kind of a messy ordeal. But I can definitely promise improved outcomes and better mobility and activity, better quality of life. Fortunately, at this point, it's like where I would ask questions, but not really sure how to move forward from here. I guess you could message us on social media, and we'll stay online a little bit, see if we get the messages. I'll be happy to answer anything I can.
Okay, we do have one question.
We have a question.
Yes. If I'm experiencing a lot of back pain and lower back pain from sitting all day, what kind of stretches do you think would be good for me? Do you think I should do them in the morning or after that?
So the question is, one of our listeners is experiencing a lot of back pain, low back pain, and she's wondering what typical exercises would be recommended. And again, I say this completely, and I will point back to our disclaimer. This is not formal medical advice, because to do that, I would have to read their medical history and do a good physical exam. But to answer your question directly, in general, anything that would require bending forward, trying to touch your toes, basically what we call flexion, and then extending backwards, would define the entirety of, like, the extremes of what your back was designed to do. And each of those positions, and I guess I could try them out right now. I think it'll be interesting. Can you see it in the bed? All right, let me put this coffee mug down. One thing that I find very interesting is a lot of patients come see me and they tell me that they have not laid under their belly, literally in some cases for decades. I will tell you this, if you have not laid on your belly or have not extended back, there are groups of muscles, entire groups of muscles that have not rested or relaxed in decades. And if a muscle has not rested or completely relaxed in that period of time, you're primed to go into spasm. You're primed to throw your back out. So what I tell people is, start off, if you are able to tolerate it, just to lay on your belly, okay? And if you can tolerate this okay, then you can try to get up onto your elbows. The whole point being, again, to conserve this curve in your low back. And all you have to do is hold this for 30 seconds at a time. 2 times in the morning, 2 times in the evening, and I think that's a decent place to start. Like I had mentioned before, it's about defining the extremes of motion. So that would be the extension, the going back part. I think people should also work on the going forward, as in like trying to touch your toes. Now, when I tell people this, you should never, ever hold anything that hurts. And if I go down, I'm like, oh, I feel the pull right here, and this is where I would stay. I would hold it for 30 seconds, and I come back, I relax, and I don't repeat it until I'm feeling completely normal again. Beyond that, I think that's a good place to start, because beyond that would require, really you should require like a more involved, in-depth analysis, particularly by a physical therapist. Thank you for the question. I grab my coffee mug again.
Another question. I experience a lot of joint pain when walking, and I do have arthritis in various areas of my body. Would stretching benefit me, and do you have any recommendations?
So the question from from another listener is, they seem to have a lot of joint pain throughout their body, particularly while they're walking. They're wondering if stretching would help them. Now, again, this is a little difficult for me to answer because I do not know your particular case. In general, stretching when you have arthritis is, I won't lie to you, a double-edged sword. And this is how I describe it to my patients whenever the topic is brought up. The notion of stretching will cause some friction to happen. It will cause pain. The positive part about it is, if you move, you don't lose that range of motion, the ability to move in itself. Arthritis is a very interesting thing. No one is ever going to beat arthritis. There's not a darn thing you're going to do to fix arthritis. The best thing we've gotten in medicine is literally cut off the joint and replace it with metal. That's not a great answer. But the example that I give my patients is, imagine a hinge on a door. It's made out of metal. You wait 20 years, that thing, you can't stop that thing from rusting. It will rust. If you keep that door closed for those 20 years, the next time you try to open it, that thing is basically a wall. You're not going to open it. You're more likely to blow it off the hinges than to open that door. Now, reset that scenario. If you take that door and you open it every day for 20 years, you go back 20 years from now, you go to open that door, those hinges are going to scream bloody murder, but that door will likely open. That rust will lay in place, but that door will open. And that's how I use this analogy to describe the benefit of stretching when you have known arthritis. You will retain that range of motion. Yes, you will be in pain, but it will decrease the overall loss of function and decrease your overall extremes of pain if you continue stretching. So yes, it will help, but not in the manner that most people understand it to. So I hope this helped. Thank you for the question. I think we're running out of time. Okay. Thank you for joining us. If you have any other questions or any inquiries pertaining to your particular case, please come by at Pennsylvania Pain and Spine. Myself and my colleagues will be happy to answer any other inquiries you have regarding this and basically any and all medical issues. Take care of yourself, and thank you for joining us today.